Today we have a wonderful patient in her mid-30s, and initially she had a lap band. She lost a little bit of weight, but not quite as much as she had hoped for. So they removed the lap band and did a vertical gastric sleeve, and then proceeded to lose about 105 pounds. And her weight is now stabilized. She previously had breast surgery, and now she comes for lower body. And what we're going to be doing today is called a 360, because it goes all the way around, circumferential, sort of redundant, but it goes again all the way around, lower body lift. So that entails pretty much a tummy tuck, a hip lift, hip reduction, and a buttock lift, buttock reduction. And what I do is I make an incision on the top portion of the buttock here, and then I go down the buttock, dissect all this down to the infragluteal fold there, and then bring up the buttock, and I expect to remove something like there to there, and this portion gets lifted up. Then I'm going to flip the patient over and continue that incision around the front. So we're going to bring this incision nice and low over the pubic region and out over to the other hip. And then I'm going to plicate or bring in that six-pack muscle for probably like a good 4 to 6 inches. It's going to be good. Get that tummy nice and flat, and then probably get this upper line pulled down to this area. Then if everything is good and stable and she's healthy, we'll continue on with the legs. So we're going to do liposuction on the inside portion of the thigh here, and then make an incision in the front portion of the thigh here, dissect posteriorly towards the back of the thigh, and then wrap and get rid of this elliptical area of skin and fat from the groin all the way down to the knee. So let's go to the operating room and I'll show you how we do a 360 circumferential lower body lift combined with a vertical longitudinal medial thigh lift after a patient who has lost about 105 pounds. This patient went from about 250 to about 150 and has been there for a long time. No matter what she eats and exercises, it's still the same weight. So at that plateaued weight, she's now ready for a body lift if her other medical conditions allow. We checked her blood EKG, chest x-ray, urine, carotid test, stress test. So we checked her completely and she is cleared for this procedure. So now we can proceed. So on the back side here, the patient is facing down. I've been at it for about maybe half an hour, 40 minutes here, but I'm on the right buttock cheek, dissecting down to the infragluteal fold where the buttock meets the posterior thigh. And I'm right on top of buttock fascia here. This is a patient lost over 100 pounds and wants to get rid of the excess skin and fat from that weight loss. All right, so I'm measuring the tension in the patient's flap here. I put my towel clamps down. This is what we call the static line, this upper line on the right-hand side. So this one's fixed, it's not moving, but this one I can adjust. I can make it looser, I can make it tighter, just sort of depends where we want to place it. So out here over the center portion of the buttock, we like to put not too much tension because when it heals, there's a lot of tension in this area, so the flap's a little thinner here. So I'm measuring the tension between my towel clamps. Is this too tight, too loose, or just right? So we're done at the back side. Again, that entails an incision across the top of the buttock. I dissect down infragluteal fold. I free up all the connective tissue, try to preserve as much muscle as possible. And what I was able to remove is a specimen about this big, across the top of the buttock here, across the top of the buttock here, and then I sewed this layer up in about 6 layers. So this area now is raised up. She has good projection on the buttock, good profile. I think she's getting an excellent body shape because of her hourglass contouring here, because we brought that incision a little bit higher. So we're going to flip her over now and do the front side, which is the abdominoplasty portion. So this is Marcaine. Marcaine is a local anesthetic, which I inject just underneath the fascia. Fascia is this layer on top of the six-pack muscle, rectus abdominis muscle, and this is going to help with post-operative pain. I inject it because it will help, and it takes the sting or the bite away from this next step that I'm going to do where I tighten up the muscles. There's the rectus muscle, lateral borders. Now I'm going to see how tight we can get it. Remember those 4 inches? Boom. She just lost 4 inches on her waistline, okay, with 1 stitch. Now we're going to rely her whole rest of her life on 1 permanent stitch to get a 4-inch reduction in her waistline? No, we're going to put a lot more of these sutures in place. I do a 2-layer closure, permanent sutures to get this nice snatched waistline. And we're just going to keep on marching here. So now this is nice and flat on the pubic bone. This area now is reduced nice and flat. I think she's going to get an excellent result down here. So what I'm going to do is I'm going to put a second layer on here, and then I'm going to bring this flap down. I'll just show them. And then I hope to remove everything from here to where my towel clamp is up here. Got some little areas I'm going to release there, but ideally here over the hip, we can get rid of all this excess skin for her.
You're in my head again. A memory was sitting on the edge, swinging up.
So we're done. 360 circumferential lower body lift combined with a vertical medial thigh lift. Did liposuction of one leg, took out about 800 cc's of fat with liposuction, and then made an incision from the groin down to the knee. She really didn't like the excess skin and fat that extended from the groin to the knee.
You got that same old smile, and we go looking for the same old.
So that's how we do it. I think she has a great result. Again, we took out a little bit over 10 pounds, and I think she's going to be very, very happy. So she's out in the recovery room now, and we're just going to watch her heal up now. Thank you very much for watching, and we look forward to seeing you next time.